Good day, everyone. I am Dr. Tomio Petu, a public health physician. This is my reminder to you to stay safe, keep your homes clean and pest-free. Also remember to wash your hands regularly, and if you feel ill or any of your family members, please remember to see a healthcare provider first. Keep listening to Solutions Clinic.
Get ready to supercharge your life as we dive deep into the latest trends in health, expert insights, and practical tips to help you live your healthiest and happiest life. Catch the rhythm of wellness with Vic Riches on Solutions Clinic every Monday from 10:15 a.m. to 11 a.m. on Solutions 93.9 as we journey into the world of nutrition, fitness, mental health, and other holistic approaches in the world of health. Don't miss out on the valuable information that can transform your well-being, because a healthy life is your ticket to a wealthy life.
My name is Olatoye Ujo Baba Funke, LGA Supervisor for Breakthrough Action Nigeria TB Intervention. Tuberculosis is real. Everyone is at a risk of contracting tuberculosis. So my sister, please check that cough. My brother, check that cough. Check the night sweat. Check that weight loss. TB testing and treatment is free at any primary health center. So please save your life and save the lives of those around you. Keep listening to Solutions Clinic on Solutions 93.9 FM. Thank you.
Santa Claus is now right here at Solutions 93.9 FM, kids. And you can have a fantastic end of the year party also. With just 2,000 Naira, you can see Santa Claus right here. And guess what? With the same ticket, you gain entrance into Solutions 93.9 FM's annual Kiddies End of the Year party.
Party after party, after party, after party.
Parents, schools, churches, and organizations. From December 1, 2023, Santa Claus will be here with goodie bags for your kids. With this token, you can allow your kids to experience the wonders of Christmas and the pleasurable end of the year season. If you demand, we can also transport Santa Claus to your schools, your churches, and your organizations and anywhere at a discounted rate. All you have to do is reach out to us at 100 Obafemi Awolowo Way, Aweni House, Okeado, Ibadan. Or you can contact us on 0817-452-0785 or 0818-090-5832. Solutions 93.9 FM Santa's Grotto. Let the kids breathe.
Alright, it's a beautiful Monday morning right here on the Remedy Dial Solutions 93.9. It's exactly 20 minutes gone past the hour of 10. Welcome to another edition of Solutions Clinic, where we get to talk about everything and anything health. My name is Vic Riches, and this morning we're going to be talking about tetanus. Well, by way of introduction, tetanus, also known as lockjaw, is a serious bacterial infection caused by a bacterium. This bacterium is commonly found in soil, dust, and manure, and enters the body through wounds or cut, especially deep punctured wounds. One of the bacteria enters the body and it produces a toxin that affects the nervous system, leading to a muscle stiffness and spasm. Tetanus symptoms often include jaw stiffness, difficulty in swallowing, muscle rigidity, and fever. The condition can be life-threatening if it is left untreated. Joining me this morning for this conversation is Dr. Chukwuma Okoli, but is joining me virtually. Good morning to you, Doc. It's great to have you join us.
Thank you. Good morning.
Thank you. Trust you had a great weekend.
Yes, I did. Thank you.
All right. Compliment of the season to you as well.
Yeah, thank you. Thank you.
All right. So let's start off the conversation with, this little introduction that I gave. I told you last week that I had an accident and
Yes.
I did not take tetanus injection because I was not aware of it. And that's what spurred, this conversation this morning. So I think my first question would be, why is it important that after an injury, be it deep or because I went back to the pharmacy that, treated my wound, and I asked the lady, I said, why didn't you prescribe a tetanus injection for me? And according to her, she said my injury wasn't so deep. It was on a surface level. But I spoke to a doctor, and he said to me, whether it was deep or not, it's very important that you take that. So why should one take a tetanus injection immediately after an injury?
Thank you very much. Good morning, listeners. It is very vital that you take tetanus toxoid injection after every open wound, whether deep or superficial. Now, it is essential because it depending on what item caused the wound. I've had a cut on my forearm before that is caused by the window of a neighbor. Okay, so while passing by the window, I didn't know that my hand got in between, and then I got a wound on my arm. So what did I do? I headed straight to the hospital, poured spirit on the wound, and then I went to the pharmacy section, procured the TT injection, and it was administered. Why this? That is because you see every potential item that caused the wound as a template for the tetanus toxin to fall on. Now, yes, that is it. So it is the tetanus bacteria that causes it, Clostridium tetani, is on that surface. Once it comes in contact with the skin, it will stay put on the skin. As a matter of fact, the incubation period is between 3 days and 21 days. The unfortunate thing is that in 21 days, this wound may have healed up. Recently, I lost a patient whose wound had healed up. The wound had healed up, and yet he still had the tetanus infection. So what does this tell us? Whether you have an open wound or you have a deep wound, take the injection so that you can destroy all the tetanus toxoid on the wound, and that puts the wound at risk. So it is essential and vital that everybody having that open wound should be injected with the tetanus toxoid, because you want to eliminate all forms of Clostridium tetani that may be on the wound surface.
That's interesting. And you mentioned the incubation period within 3 to 21 days, and you said that it's very possible that your injury might even cover up and be totally healed. And
yes,
wow. So in cases like that, where in my case, for instance, you did not take the injection, is there a way to now salvage the situation?
Very well, yes. Now, tetanus toxoid should be administered within 6 hours of exposure to the item, whether contaminated or not. The truth is that all these bacteria you can't see with your physical eye. There's a patient that I lost, like I said recently. He had a tussle with a friend of his over 2,000 naira. And then they fought, and in the process, an iron created a wound on the knee. Unfortunately, the wound had healed up, and all of a sudden, he developed a trismus. And he developed the lockjaw, and then he had the spasm. He was brought in from Lagos, but unfortunately, he died in less than 24 hours. He was brought in from Lagos. And what's the situation? It was because he wasn't giving tetanus toxoid. Now, within 6 hours, TT should be administered. However, if by virtue of availability or location, you were not where you could receive the TT toxoid within 6 hours, the moment 6 hours time has expired, you need to take the TT and what is called ATS, anti-tetanus serum. So you still be given the tetanus toxoid injection, 0.5 ml, and then anti-tetanus serum after a test dose. The essence of this is to make sure that all the bacterial Clostridium tetani is destroyed in and around the tissue to avoid tetanus. Tetanus is better avoided than experienced because survival rate is quite low, depending on, from one, proximity to the brain, like this person had a cut on the knee, but he still died. And I think it's because treatment was not commenced on time, or the appropriate treatment was not given on time. Now, for people that have wounds from their upper torso up, it is closer to the CNS. So such a persons are more liable to develop tetanus than people who have wounds in the lower torso, in the leg, the knee, and the ankle, and so on and so forth. And then the period of the trismus, that is lockjaw, between the period of the trismus and lockjaw to the first spasm, the earlier the spasm from the trismus and lockjaw, the dangerous and the deadly it is. So it is better managed. I've managed some patients successfully who had just rhizus sardonicus, what we call devil's smile. We have trismus, we have the lockjaw. We've managed patients with such situations, and they did not have spasm at all. It is better managed that way than when they develop the spasm. It becomes deadly at that point. Everything is now become a game of chance.
Well, this lockjaw that you speak of,
yes.
How does it appear like?
Thank you. From the word lock, jaw, meaning they can't even open their mouth. You tell them open, and then they just shine their teeth at you, and you realize that the jaw is stiff. It can't open beyond probably 1 centimeter or 2 centimeters, meaning they can't even swallow rice. They can't, in fact, they can't take a spoon in to swallow. So that will tell you how serious it is. When they can't even open their mouth to put in the spoon, that means all they can take by mouth is liquid. Even the liquid, the periodicity of the spasm, the periodicity of the spasm between one to another would also mean if he's having a frequent spasm, they don't even allow them to feed because they can aspirate from the period of spasm. They can aspirate from the period of spasm. And when all this continues, it spells doom for the person concerned. So lockjaw meaning their jaw is locked. It can't be opened for them to feed.
And they start experiencing all these symptoms after 21 days?
Yes, exactly. After 21 days.
It's quite serious.
Even though statistics are proven that about 10% of them has proven to be fatal, in recent times, the statistics is more than 10%. And here's the reason. The socioeconomic situation of the country doesn't make it easy for people to access treatment on time and well. And that's because we know that things are quite expensive nowadays. And then to go to hospital, you know you're going to spend money on drugs. We all know drugs are expensive. Some pharmaceutical companies have closed. Now, a new set of pharmaceutical companies have shut down and does not have plans to open in 2024. We heard about P&G that has shut down activities, and all they'll be doing is importation. That means they are no longer doing production, which means about 3,000 or 4,000 staff nationwide will be sacked because all they will be doing is importation. That means they are as good as haulage companies. They import and distribute. All they have is outlets. Like imagine Pampers now, you import it and then you distribute. That's all. Meaning they're not going to be producing those things in Nigeria. Why? Because cost of getting these raw materials to produce is on the increase. And they don't want to run out of business, meaning they don't want to, if Pampers were sold for 3,000 for a pack, they don't want to increase it to 6,000. That means they can't afford to pay the production staff. Hence, they just import and probably sell at 4-5, and that is it. But 1,000 plus people, 2,000, 3,000, 4,000 plus people will be out of jobs. So you see, this problem is just increasing. The purchasing power of Nigerians has been reduced, as our president has said he was going to do. So we have a lot of problems facing us as a country. So now say you want to go to hospital, so people prefer to call a nurse. You see, that was the same thing that caused the death of that musician. Calling a nurse is not a bad idea. But let everyone being called know the extent to which they're ready to go. Because the moment you step up to treat people, you are taking responsibility, and you must be ready to follow it up to the very last. And that is why when situation goes out of hand, at that point you say, oh, let's quickly rush him or her to the hospital. It becomes a game of chance. It becomes a 50-50 thing. And I think that was why. And in fact, I also wanted to tell you, sir, that boy that we lost, I actually noticed that the wound was breached a second time. You see? And then you see where the ignorance comes in. This wound was contaminated, or let me say, created by an ion that contains Clostridium tetani. And now he's beginning to have trismus lockjaw. You went and said it is the wound that caused the problem. You reopened the wound a second time. With what instrument? And these are the seeming problems that we have in the country. This is where ignorance plays a greater role. And of course, the next thing, just 22 years of age, and he gave up, and he was taken back to Lagos to be buried. Quite unfortunate. Tetanus is very deadly. It is better prevented than managed. Thank you.
Thank you very much for that insight, Doc. You're listening to Solutions Clinic right here on the Remedy Dial, Solutions 93.9. If you have a question, you want to call into the studio and ask regarding tetanus, please call 0909 888 9939 or 0912 222 2939. If you'd like to send a text message via WhatsApp or regular text, do that with 0904 422 2939. You can also send in questions via our social media platforms. We're streaming live on Facebook. Hello, good morning.
Hey, Carlo.
All right, call back if you can. Doc, I would like to ask about this. Tetanus is caused by a bacterial infection. So my question will be what the pharmacist also told me. So according to her, she said she gave me an antibacterial drug. So that should be able to combat it. And I think that's the knowledge some people also would have. Well, since it's not a deep injury, it wasn't another thing. It wasn't also caused by an ion. So are these factors necessary in that regard?
Okay, thank you very much. Now, we are discussing about tetanus. Now, let me say something. Yoruba say, whatever a situation requires is what you give that situation. I learned that from the Yoruba people. They'll tell you, if you want to handle a situation, whatever it takes, give it. Now, tetanus is quite a specific dynamic type of bacteria that tells you, you want me to stay off, give me tetanus toxoid. Just give the tetanus toxoid, irrespective of whatever antibiotic that is being given. If you don't give that tetanus toxoid within 6 hours, if you have not taken it in the past 6 hours, go get it now and get an ATS, anti-tetanus serum, after a test dose. Before you can
after what?
Whatever type, a test dose. A test dose has to be given to check for any form of reaction to it, because it is a serum.
Okay, they have to do a test before you get the ATS.
Yes, you do a test dose. That means you administer a little quantity first.
Oh, okay.
Yes, that's the test dose. So now all these things are necessary. Even if you want to go for whatever kind of antibiotics you're giving, you must give the tetanus toxoid and or the ATS. There are no jokes about it. You give those two, you can take whatever antibiotics you please, but those two have to be given. Like I said, I use myself as an example. When I had my wound, I didn't take any antibiotics. I just took TT. I washed the wound with spirit, which I believe the spirit would have healed the tetanus or whatever, toxin or Clostridium tetani. I still went ahead and I took TT injection. You see that I was being double conscious about my actions. So after I took the TT injection, I now became calm. And then I watched the wound heal within a few minutes. Few days rather. And that's the end of it. The only thing is, anytime I remember, when I see that scar, I'll be like, wow, I can still see some forms of it. This was months ago, you see. But I did not miss out taking the TT because I thought I was taking any antibiotics. No matter the antibiotic, TT is essential. It is compulsory. And it has saved many lives.
All right. I have a question here, and this is from Mrs. Tayo. My boy had a football injury without knowing what actually caused the deep cut. However, he did not take the tetanus injection within the time frame that you stated. But we're worried if it's still okay to give him the ATS at this time. It's been 1 week already.
Thank you. It is 1 week. Let that boy go to the next hospital right now and take a TT and ATS right now. Once this program is done, get it given. Don't take any chance. Like I told you about the boy that we lost, when he was brought, the wound had closed. And we found out that that scuffle between him and his friend happened about a month ago. And then they said, okay, so I asked, when did this trismus spasm and so on that started? They said almost a week. So meaning the wound had healed before the tetanus struck. Since this wound created by the boy is just a week, go take the TT and the ATS. It is important, please. Thank you.
All right. If you want to call in, I saw that the phone lines were buzzing. 0909 888 9939 or 0912 222 2939. Hello.
Good morning.
Good morning. What's your name?
Yes. Lee.
Okay. 0909 888 9939 or 0912 222 2939. These are the lines to call into the studio if you have a question regarding tetanus this morning. Doc, is there a vaccination, or is the vaccination the same with the injection?
Yes, sir, that is it.
That's the,
That
okay.
is tetanus. Yes, we have tetanus vaccine actually. As part of the schedule, we'd have that and it's available. People do take it. That's a TT.
Yes.
People take it now. Even for pregnant women, it's compulsory. They take TT1, TT2, and then they go on until they have achieved a lifetime immunity after the 5th dose.
Let's take this call, Doc. Hello.
Good morning, doctor.
Good morning. What's your name?
I want to ask that if the tetanus is up to 1 month, can we still have that injection?
Okay. Doc, I believe you heard the question.
No, I didn't get that.
Oh, so she's saying if the tetanus is up to a month, can she still take the injection?
She has a wound up to a month.
Well, that's how she put the question. So I think
Okay,
what she's saying, if the injury is over a month, can she still go ahead to take the injection? I think that's similar to the 1 week question the person asked earlier.
Yes, I had that a month, meaning it is beyond the 21 days max period of the incubation. Hence, there was no infection, there is no tetanus, there are no trismus, no spasm, no rhizosardonicus, no lockjaw, nothing. Well, good for her, she has escaped. Here is my advice. She should go and start taking her TT now and then follow the schedule until she can complete it up to the lifelong immunity stage. Once she goes to any hospital, they would arrange it for her, give her date. She would take the first, second, third, fourth, fifth, and the lifelong immunity, and then at that point she can write.
Oh, okay, this is a new revelation. You can take it even prior to sustaining an injury.
Yes, you can. You can take it prior to sustaining an injury. In fact, it's advisable you do that. And if you just recovered from an injury situation, it's still okay that you start.
Okay. So you mentioned it has a schedule of some sort that you take
Yes,
for a
it
period
does.
of time.
Yes, it does. It has a schedule. So she can also do that so that everybody will be at rest, complete the dosage, and have a lifelong immunity. People like us can't have, even despite that I have a lifelong immunity to it, that means I have completed my own injection period. I still took TT when I sustained that one. I still took. Just to be sure. Yeah, you have to be alive to fight. Don't put yourself in the line of risk just because you want to be careless.
So is this similar to what you were trying to explain about the vaccination?
Yes,
That's it.
It is the same thing as the vaccination.
Okay. 0909-888-9939 or 0912-222-2939 are the numbers to call into the studio this morning if you have a question regarding tetanus. All right, this is a question here from Mrs. Steyer, but let me take this call before I get right into that. Hello?
Good morning. I want to ask if the vaccination is free.
Okay. Doc, did you hear that?
No, I didn't. I don't get to hear when they talk.
Oh, I don't know why that's a challenge. So I'm sure the answer is no, but let me let you do the
Okay.
honors. She's asking if the vaccination is free. You already mentioned economy, so I think it's another opportunity to answer that question.
Okay, this is just it. It's not expensive, okay? It's not expensive at all. It's not expensive. I promise you that. It is not. I say that again. It is not expensive. It is just very, very affordable, okay? I'm just talking about a few hundreds of naira. So please go get it. It's not expensive at all. At all. It's not. So let that not be an issue. Let that not bother you. It's something you can even if you want to pay for the whole process in advance, go ahead. But like I said, it is affordable, very affordable.
Okay. Hello.
Good morning.
Good morning. What's your name?
Affordable. Like what for her?
Okay, I don't know. I could not hear your question clearly. But if you like to call back, please do that via the numbers 0909-888-9939 or 0912-222-2939. Here's a question. Good morning, Doc. You said any form of tear. Are you saying if I have a razor blade tear, I should go to the
Yes.
hospital and get a tetanus injection?
Absolutely, 100%. You must. Once there is a breach on your skin, whether the breach is caused by a razor blade, by a kitchen knife, by a wire, by a net, by a burglary, by a machete, whatever it is, once there is a breach on your skin, get a TT injection, please. Thank you.
Okay. All right. Call back if you can. 0909-888-9939. Hello.
Good morning.
Good morning.
Yes, we are in hospital. And
I can barely hear you. Please go over your question again.
we are already in all hospitals.
Perhaps you want to try texting me, okay? I could barely hear what you were trying to communicate this morning. We're talking about tetanus, and there's quite the revelation that I am getting of this. And we must say that knowledge is indeed wealth. Doc, so my next question
Okay.
this morning would be, if you start noticing these symptoms, I know you mentioned earlier that recovery is late, but early presentation, does that salvage it in any way?
Yes, of course. I mentioned that earlier. I said the earlier the better. That means the earlier you take the vaccine, the earlier you take the ATS. If you miss the vaccine, it's better.
No, I mean when
And
you
then
start getting the symptoms, spasm and yes.
Yeah, I was going to say that next. That the earlier you present to the hospital as well, for those who miss okay, something happened. There was this lady, she had a wound, tooth issue. I think she went for a dental procedure. And next thing, she couldn't open her mouth. She had lockjaw. I was scared, from a dental procedure. And I told you that the nearness to the brain, the more dangerous it is. Look at the jaw, look at the brain. They are both on the same head. So I knew there was trouble. But that very morning, when she noticed she could not open her mouth, she came to the hospital. We gave her TT, we gave her ATS, we admitted her, we started giving the antibiotics. She was fine. She made it through. She never had any other symptom beyond that lockjaw, and she recovered. Because she presented that very morning that she had that lockjaw. So the earlier the presentation, the better.
Okay. Hello?
Hello.
Yes.
I want to ask if the injury is of bone or braces, is it still like somebody should still get that tetanus, or the bone with a kid at tetanus?
Okay.
So,
Okay. Doc, so the question is, if it was some bruises and maybe a fire burn to the skin.
So bruises and what?
If it was the person sustained bruises
Okay.
or had a fire burn their skin, should they also
Exactly.
take the injection?
Thank you. Let me say it again. The moment you have a breach on your skin, no matter what it is, once there is an exposure on the skin, bruise, burn, knife, blade, bottle, plastic, anything that can produce a wound on your skin, no matter what it is, you must take the TT. Remember, the incubation period is 3 to 21 days. However, some people after day 10 can develop symptoms, so we need to be careful about it.
All right. Thank you so much, Doctor, for such great insights you've shared on tetanus this morning. I believe this has been very helpful, particularly to me and everyone who listened. Thank you for being a part of the show.
You're welcome.
All right, that's it on Solutions Clinic for this Monday. We'll be back, of course, next week Monday with yet another revealing topic on health. My name is Vic Richards. Have yourself a great start of the week.
Good day, everyone. I am Dr. Tomio Petu, a public health physician. This is my reminder to you to stay safe, keep your homes clean and pest-free. Also remember to wash your hands regularly. And if you feel ill or any of your family members, please remember to see a healthcare provider first.